Your doctor has provided you with this video to help you learn more about multiple sclerosis and Betaferon. You may have heard of multiple sclerosis. You may even have met somebody with MS, but now that you've been diagnosed, there are probably a lot of questions on your mind, like what is it? How did I get it? How can I treat my MS? And probably most importantly, how will it affect my life? Despite what you think you may know about this condition, you can live a full, active and healthy life with MS. But first of all, let's find out exactly what MS is. Every movement that you make and every sensation that you feel is as a result of a complex system of nerves running throughout your body called the nervous system. Now, these nerves allow the different parts of the body to communicate. So, for example, if I want to drink this cup of tea, a message from my brain travels through my nerves to the muscles in my arm and then onto the muscles in my hand. And then the nerves in my hand sense that it's too hot. So they send this message to my brain, which returns a message to my arm telling me to put the cup down. This whole process of decision and action involves signals travelling through the nerves in my body. These nerves work like electrical cables, with an inner wire which carries the signals and an outer insulating layer. This insulating layer is called the myelin sheath, and if the myelin is damaged, the signals can't travel properly. In MS, the body's own immune system attacks and destroys the myelin sheath, forming scar tissue. This process is known as demyelination, and the area of scarring is known as sclerosis. Because the scarring happens in more than one place, it's known as multiple sclerosis. Without myelin to insulate the nerve, messages arrive late, confused, or not at all. MS may result from a combination of factors rather than a single cause. It's thought that environmental and/or genetic factors may be involved. However, the exact cause of MS is still unknown. Each case of MS is different, and each individual will experience their own set of symptoms, depending on where the myelin is damaged. Now, some of the common symptoms of MS are things like poor coordination, or fatigue, blurred or double vision, or a numbness and a tingling of the limbs. And some of the types of MS are relapsing remitting, secondary progressive, primary progressive, and benign MS. The most common form of MS is called relapsing remitting MS. With this type of MS, people experience a temporary flare-up of symptoms referred to as a relapse. Relapses may last from hours to weeks. These relapses are followed by periods of remission with complete or near complete recovery. The degree of recovery between relapses varies greatly from person to person and from one relapse to the next. Secondary progressive MS often follows on from relapsing remitting MS. At this point, the remissions are fewer and the disease gets progressively worse. The length of time it takes to progress to this stage varies from person to person and usually happens many years after the first onset of MS. Primary progressive is the least common form of MS. In this form, there is no remission period and the disease progresses without break. People with benign MS typically experience 2 or more attacks with remissions, followed by complete recovery. Attacks may be many years apart. There are now very effective ways of treating MS. Now, although the damage to the nerves can't be reversed, this damage can be slowed down using drugs called interferons. Now, interferons are proteins which are also naturally produced in the body by the immune system. There are many different kinds of interferon, and the one that's used to treat MS is called interferon beta. Now, interferon beta 1b is available as Betaferon, and there are more Irish people with MS using Betaferon than any other interferon treatment. The immune system defends the body against infections like the common cold. This defense is coordinated by immune cells, known as T cells. Normally, these cells would only be involved in attacking infections such as viruses or bacteria. In MS, these T cells become confused, and the body attacks its own nerves by damaging their myelin covering. Betaferon helps stop the body from attacking its own nerves. It's thought to reduce the number of confused T cells and to actually block some T cells from entering the brain. Fewer T cells entering the brain means fewer T cells destroying myelin. And as for those T cells which do enter the brain, betaferon helps prevent them from doing more damage by continuing to protect the myelin sheath. As long as the myelin sheath remains intact, it allows the nerve messages to travel at the correct speed along the nerve. So these actions mean that betaferon has a very positive impact on MS, and research has shown that betaferon can actually help reduce the severity and frequency of relapses when they do occur. Because interferons are proteins similar to those in food, they'll be broken down like food if they're swallowed, and so they need to be injected into the body. Many people have a fear of needles and are uncomfortable with the injection process, but there are ways by which this can be made much easier. People who start betaferon will have the benefit of the nursing support programme provided by Sharing. So Eilish, can you tell me a little bit about this programme?
We're a team of 6 nurses placed right throughout Ireland, and we are dedicated to people who are taking betaferon. And our role would be to educate and support the patients and their families at the start of treatment, and indeed throughout the course of their treatment, about all issues relating to their betaferon therapy.
Listen, I just wanted to ask you a couple of questions about this medication I'm after going on.
Sure, no problem.
And what type of questions and concerns do you find people have?
Well, the biggest concern people have is how are they going to give themselves an injection? That's the most concern that people express. So what we have come up with is a device called the Betajet Lite that helps people give the injection without having to actually look at the needle.
So how does the Betajet Lite work?
You actually place the betaferon into the body of the Betajet Lite, place it on the area you have chosen to actually give the injection, and press a button. And it's as simple as that, and it's very popular amongst people who are using betaferon.
So how would people know how to inject it or where to inject it?
That would all be part of the nursing education programme for patients starting betaferon and indeed their families. And we would give patients some charts and some guides as to where and how to give the betaferon. And of course the betaferon support nurse would be in regular contact with the patient in any case, so that if there are any concerns that they can be addressed quite quickly.
Are there any side effects?
Well, the most frequently described side effect would be that of flu-like symptoms, where people feel almost like they have a flu. And the treatment for this would be to take paracetamol at the time of injection, or also to take the betaferon before going to bed, 3 or 4 hours before going to bed. That way you sleep through the side effects. And they may last for the first few doses, but generally speaking, they disappear after a couple of weeks on treatment.
So what about if you go travelling or go on holidays or...?
There's no difficulty going on holidays or travelling with betaferon. In fact, people travel all over the world. I just met somebody yesterday back from Australia, having spent 3 weeks there. Sometimes there are questions regarding the time of travel versus the time of taking betaferon, but the betaferon support nurse is always only a phone call away to answer those questions. So no, there's no reason why people can't travel wherever they choose to.
And how does this medication affect somebody's regular lifestyle?
Well, people like to live as normal a life as possible. So by taking the betaferon every second day, people manage to weave it into their lives quite easily. Some interferon treatments are taken once a week, but a recent study has shown that taking betaferon every second day is actually a more effective way of treating multiple sclerosis.
And could you take it if you were pregnant?
If you become pregnant or if you're planning a pregnancy, it is advisable to stop betaferon. However, it is preferable to restart betaferon as soon as possible after delivery. However, it is not advisable to take betaferon if you decide to breastfeed.
And what about socialising or going out for a few drinks?
Well, it's important for people, from their own perspective, to continue their social life and their normal everyday life as they would before going on betaferon. There's no reason why people can't take a drink or two if that's what they like to do with weekends or whatever. We would advise patients to take their betaferon maybe before they go out on a Friday evening or whatever, so that it's done and taken, and then they can carry on and enjoy themselves.
Is there any issue with taking betaferon with any other medication?
One should always check with their doctor before taking any other medication. But a very frequently asked question to us is, can I take the oral contraceptive pill while taking betaferon? And the answer is yes, it's just as effective.
MS is a complex condition that requires skilled and ongoing assessment, reassessment and care. However, multiple sclerosis is certainly a condition that one can live with and cope with successfully given the appropriate support and treatment. Betaferon can contribute significantly to achieving the balance between MS and normal everyday life. There are approximately 6,000 people with MS in Ireland, and neurologists have chosen to treat more with Betaferon than any other treatment. So if you want to learn more about Betaferon, ask your neurologist, your physician or your MS specialist nurse.